is here.
Sponsored locally by TVFCU.
Come live your best life at Eastridge Residence.
As we are journeying through this conversation on eating disorders, no doubt you're beginning to realize that they are very complex, very multi-layered, and individual as the person who is diagnosed. But perhaps you're beginning to hear kind of a common theme that there is a mental component to all eating disorders when they are diagnosed. We want to bring our panel back in again for you this morning. Pamela Kelly is a nutrition therapist here in Chattanooga. Aaron Rayburn is a licensed marriage family therapist with Evergreen Therapy. Dr. Chris Harris next to me is a licensed professional counselor, and so is Emily Collier, who is also with the MCR Foundation. Welcome back. So we had this wonderful conversation about the different types of eating disorders and kind of getting into the way those look and what parents and families can kind of do to support a little bit. But there is the real elephant in the room, if you will, that people don't address, and that is the mental component to all of this. I'm going to start with you, I think, Aaron, because from the family perspective, what happens to one happens to all.
Correct. Yeah, I think it can be hard to address that there's anxiety, depression, by possibly bipolar disorder, trauma that is underneath these behaviors. And as we were talking about this earlier, the shame and the guilt isn't just the patient or the one exhibiting the behaviors. It's often felt throughout the entire family. So to overcompensate for the behaviors or the mental disturbance, parents, siblings sometimes try to cover the behavior or overcompensate, fix what is happening, not really addressing the core issue, which is the psychological component, the feelings that are felt throughout the home. Often I find that feelings can be very difficult for family units to talk about, and so there's a lot of shame around why do we feel the way we feel.
So okay, when they come to you in your practice, do you see the whole family at one time?
Yes, often.
So does that come with a bit of a risk, if you will, because they need to make it work, I guess, open up and talk to you, and yet there can be some honesty that hasn't been presented before?
Oh, absolutely. It can be pretty intense at times, but I think that's part of the process, is tolerating that intensity, experiencing that together and coming through that together. And that's a lot of the work that I do with them, help them name what they're experiencing in that moment and move through it.
Emily and I have talked a lot over the years, and even as many conversations as we have had, it still is a lot to fully understand. Just when I think I'm kind of getting it, I learn something else. So this idea that there's this underlying mental component, you're a big believer, Emily, in jumping early, trying to prevent.
Yes.
Is that right? Because if you have, let's say, a depression situation, we'll make it kind of easy. If you don't really get the help that person needs early on, then it can progress to becoming an eating disorder. Do I have that right?
Yeah, I mean, I think early intervention for any mental health issue is key, especially eating disorders, because if you think about if you can catch it if the individual has been engaging in, if it's an eating disorder behavior for a year, those kind of habits might be, they're still difficult to undo, but if compared to, let's say, someone didn't seek treatment for 12 years, then you have 12 years of patterns and behaviors to try to undo and unpack. So yes, early intervention is often the key to prevention long term.
This is probably a very dumb question, but we all live in our own heads. I'm sure I have things that I could be greatly benefited by having someone help me address, but I might not know it because I know me. Do you understand where I'm going with this at all, Pam?
Yeah, I do. And I think, it's almost like the devil you know versus the devil you don't. There's a certain amount of comfort in behavior that you've gotten used to. It's avoiding life or avoiding circumstance, not wanting to let the family know because you're going to disappoint them if they know that you're struggling. But eating disorders never stand alone. There's always other things going on, and that's why it needs to be a team approach. These wonderful experts that you have sitting here with you today all have their own unique way of looking and supporting, whether it be a specific type of eating disorder or recognizing that this needs to be addressed in a trauma situation, or there's neurodivergence going on that needs to be addressed that might not be. So it's not just a nutrition issue for sure,
Right.
but nothing can be handled if the brain isn't nourished and if the body isn't nourished.
How do you handle, Erin, and Chris, if you want to jump in, you feel free too. I'm going to throw it to you though on the family side. How do you handle a conversation with somebody, I'll go with a teenager who is being diagnosed here, and you've got to address the mental component to it and help them see that the issue to be dealt with here is theirs to fix, if you will, but not have them feel guilty for it or not have them feel targeted. It's hard. You don't forget words that are said to you. How do you do that?
Carefully. A lot of education to help them understand the nuances of this. A lot of validation that their guilt and shame that they're experiencing is normal, and helping them understand where maybe they unintentionally contributed and shift those behaviors or those dynamics. Again, it's not about blaming, it's about naming what
Recognizing?
correct about what is happening here, and then we can go forward and fix that. But that is done very carefully through a lot of trust building, going slow, obviously working with a team so that the family is getting information from not just one source.
You talk about the family, so we'll go with the unit.
Yes.
I'm guessing that Emily had talked about how early intervention sadly doesn't always happen. So these things have been going on for a while. If you've got a sibling group,
Yes.
do you see resentments that are built? Do you see other kids thinking, well, I'm not important because the attention always goes to this sibling? Is that common?
Absolutely, and sometimes you see an eating disorder pop up in the other sibling as well, unfortunately. See, families are often, there's any system, I should say, part of the operations of that system is balancing power. And sometimes children will want to rebalance that power subconsciously by developing some other problem of their own. Again, not consciously, it's not like they're trying to sabotage their other sibling, but maybe their needs are going unmet emotionally because there's a lot of attention on the client. So it's important, again, to educate the family about the nuances of this and give them a lot of support.
We've got a few minutes for the conversation. Chris, if you were going to give advice to somebody watching, and maybe they had a child who has recently come to them and said, I'm dealing with anxiety or depression, or they're just noticing it on their own. We live in kind of a medication-happy society, which is fine, but I guess, in this part of the conversation, talk is really important, right? Do parents need to do both at the same time? Do they begin with counseling? Where do they start?
So the research says that both. The best is a combination of talk therapy, having, like we were talking about, a full team approach. So you know, you can create your own treatment team with your child by letting your doctor, their therapist, your therapist, the dietitian, everyone know who each other is and have releases to talk to each other. And we do that often with our clients and their families. And you know, the education we were talking earlier about is, it's interesting that a lot of times the eating disorder is the answer to what you were talking about, well, some of the underlying conditions. And when parents and the client start to understand that, they start to make sense of it, and then you put a piece in the puzzle. But eating disorders can be an answer for a trauma, it could be an answer for anxiety, it could be a way of coping with the stress of their life, in addition to the other things we talked about.
So that's where MCR comes in, because if people will call you, Emily, you can kind of get this intake of information to try to know who to best place somebody with. That's the whole reason you're here.
Right, exactly. So when you do call, you get me every time. And so it's almost like doing a little mini intake. Okay, let's talk, like, tell me what's going on, so that I can help best place you. Do we need to look at, do you have a therapist yet? Can we start with just therapy and dietitian? Is this more severe and we need to get a physician involved, because we might be looking at, does this person need inpatient treatment? So yes, so when you call, you can ask questions. You can, we do like a little mini intake so that I can help best get you to what you need to do. Our whole reason for being here is to help people navigate these issues and help them get to the professionals in the community that specialize in these very things.
And you heard them say probably earlier that it touches about 4% of women, 1 to 2% of men in the country, but that is diagnosed. You told me once, Emily, or maybe it was you, Pam, that Hamilton County has one of the highest rates of eating disorders in the state. Is that correct? Do I have that right?
Yeah.
Is it as many as 1 in 10? Is that a number that I'm supposed to remember? Or am I faulty there?
I'm not going to commit to that number,
Okay.
but it's high.
But it's high.
It's high.
It's high. So it's very valid for us to be bringing this conversation your way, because there's a real reasonable chance that everybody watching this morning knows somebody who
Absolutely.
is struggling, and you might not know it, but it doesn't mean it's not true.
Right.
Thank you.
Hello, I'm Kevin Bragg from Bragg Weight Loss. We change lives every day. I would like for you to meet a few.
I'm Laura, over 40 pounds with Bragg Weight Loss.
My name is Ricky Sharp. I've lost